Good afternoon, everybody. We are about to start our Washoe County District Board of Health meeting. We're going to call the roll, please.
Chair Novak.
Here.
Vice Chair Brown.
Here.
Oscar Delgado is absent. Christopher Dare is absent. Dr. Danko.
Here.
Marsha Burke-Bigler.
Here.
And Tom Young will be here momentarily. We have a quorum.
Good, thank you very much. Pledge of Allegiance is next. Dr. Danko, you want to start us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, next item on the agenda is public comment, and we have one public comment from Mr. Pitkin.
My name is Michael Pitkin. It seems as though there is a double standard of health care in Nevada. Females do not want non-pregnant, non-females mandating control over their body. Yet HIV-positive homosexuals are mandated control over by non-HIV-positive, non-homosexuals in their care. I've heard this overused public health message since 1980. Today, under Trump, intimidation and retaliation is happening as care providers follow their religious or moral beliefs. Conscious and Religious Freedom Division eliminates protections, and according to Mara Kiesling, National Center for Transgender Equality empowers bad actors to be bad actors. As a Satanist, now being denied twice all HIV medical care in Reno, Nevada, this conflicts with my quality of life and my religious freedom of conscience. This not only affects me, so today I submit two petitions for signature gathering. United States HIV decriminalization to be sent to federal lawmakers. The second is State of Nevada HIV decriminalization to be sent to Nevada lawmakers, possibly for a referendum to overturn current state HIV law. It is my HIV body, it is my HIV choice for human rights and human civil rights. So I hope you'll all sign. And according to you guys, yesterday, the governor is creating a oversight committee or an exploratory committee on decriminalization. They will have half of the body be HIV positive, and they will present to the legislature September of 2020 on this matter. So thank you.
Thank you. Next, we have a public comment by Mr. Kleppenstein.
Good afternoon, members of the board. For the record, my name is JD Klippenstein. I'm the Executive Director of Action, and I'm here today to speak in support of item number 8 on your agenda, which refers to a resolution regarding an affordable housing trust fund. For the last 18 months or so, Action has worked with many other community partners, faith communities, and service providers in order to advocate for the creation of an affordable housing trust fund at the county level. And as Commissioner Burke-Bigler knows, at the end of March, that the Board of County Commissioners unanimously approved the creation of an affordable housing trust fund. And the resolution on your agenda today is to say that you support allocating or local revenue to that housing trust fund. So I'm here to say, I think that's a good idea. And also to just offer you a little bit of information. Affordable housing trust funds are a national best practice. There's 800 of them around the country. They're a really effective tool at getting more revenue into communities to build affordable housing. And as you are well aware, we are in the midst of a housing crisis, and the connection that stable housing has to community health is well documented. It's very strong. So I would encourage you to support this resolution, and thank you for your time.
Thank you. We have one other public comment from Mr. Fanning.
Good afternoon. I was here last year about the health department. I have a business, I have carts that I have go out. I used to be in the food truck business. And the prices are just not proportionate to what it is. I mean, you have food trucks paying this, I'm paying the same price as a food truck. That was supposed to be looked into last year. I got a call after I came here within days, and I met with the director of Board of Health, Chad, I don't know his last name, and we had a conversation. Tony was there too. I forget Tony, I can't pronounce Tony's last name. But, you know, it seemed to be productive. He was going to contact me on other meetings they had that never happened. I found out that he resigned. So really nothing was looked at into this situation. The Board of Health, the prices have gone up over 400% in 4 years. As a small business owner, myself and other people that I know who are small business owners, it takes a toll on us. It's not regulated properly. The new acting director I've met twice, Charlene, I will say this, she's very transparent, she's been extremely helpful. I've had 2 meetings with her, which I never had 2 meetings with anybody from the Board of Health in over 12 years. So I give kudos to her. She's trying. You'll probably have her for 18 months because she's gonna retire, but maybe in 18 months she can make a difference. I never knew there was a director of the Board of Health. For years, I dealt with Tony in my restaurants and stuff, and he told everybody that I knew that he was the boss of the Board of Health. So we don't try to have any more contact, me and him. But it has to be looked into. I mean, 400% increase in 4 years is ridiculous. It's ridiculous. And I shouldn't pay the same as a food truck when I'm a 3x5 cart. And I'm trying to operate several of them, but it's become so expensive. Another thing is, I was in Sparks for 2.5 years. I moved back to Reno here, a warehouse, nicer facility, nicer area. And, you know, for 3 years, they signed me off and I didn't have to get a hand sink because I'm the only employee in my place. And I keep my place really clean. But they signed off for 3 years saying I didn't need a hand sink. Now I need a hand sink. And I think it's one of the most ridiculous things. We have, as an operator in the food business, you have to have a 3-compartment sink. It costs you about $1,000 to put in, it's another $1,000, so it's $2,000 sink. But I can't wash my hands in that sink because I need a hand sink. So I have 3 compartments in the sink. One is for dishwashing, one is for rinsing, one is for sanitizing. But I can't use the part where I wash my dishes to wash my hands because
Thank you, Mr. Fanning.
Yes.
3 minutes.
Oh, that was 3 minutes?
Yes.
Oh,
Thank you very much.
Anyway, can I leave these copies of the prices that have gone up with somebody?
Sure,
Thank you,
sure.
sir. I appreciate your time, all right?
Thank you.
All right, thank you.
Okay, next item on the agenda is recognition, retirements, promotions. Mr. Health Officer.
Mr.
Oh,
Chairman.
I'm sorry. We need approval of the agenda.
I'll make a motion to approve.
Second, all in favor?
Aye.
Opposed? All pass. Thank you.
Recognitions.
Go for it.
All right. The Health District is, I think, experiencing our silver tsunami with baby boomers that are leaving
Always have been.
the Health Districts. We have a number of retirements this month, and I'd like to begin with recognizing David Gamble. David, if you could stand in the back. David has been with our preparedness program for over 6 years, and he's been throughout most of that time leading our MRC, our Medical Reserve Corps effort. So I wanted to thank David for thank you for your service, and best wishes on your retirement. So, and stick around, we will be taking pictures in a few minutes. Next, I'd like to recognize Dave McNinch, who has been a supervisor in our environmental health services division. Dave has been with the Health District for over 29 years. And so thank you very much, Dave. We do have a clock in recognition of your many years of service at the Health District. Washoe County Health District recognizes Dave McNinch for 29-plus years of dedicated service. Mr. McNinch started with us on September 24th of 1990. So,
Whoa.
thank you very much, Dave, and we'll get some pictures in a minute, and best wishes on your retirement.
Thanks, Dave.
So also I have Linda Gabor is, there she is, right up in front. That's why I didn't see her. Thank you for standing, Linda. Linda is a public health nurse supervisor, and I believe the information I have here is incorrect because it says she has 14 years of service with the health district, but that's, I believe, just your latest stint with the health district. So can you help me out with your total? 30 years. 30. So that's a long time. So thank you very much for your service, Linda. And we also have a clock for you. And then also I want to recognize Mr. Kutz's, Steve Kutz's retirement. Steve's, as you know, has been serving as our division director for community and clinical health services. And Mr. Kutz has 30 years of service with the health district. And so I want to congratulate Steve, thank him for his service, and best wishes on his retirement. And we do have a Something Sweet event happening after the Board of Health this afternoon. So if people are able to make it over to Central Conference Room, that's where that will be held. And we have, of course, a clock for you as well, Steve. So thank you very much. And I'd like to also announce that I have appointed Charlene Albee to be the division director for the Environmental Health Services Division. So if you could please stand, that's a promotion for Charlene, and I really appreciate her willingness to take over the leadership of that division. Thank you very much, Charlene, and I believe I heard that you may be retiring sometime in the next few years. All right. And then we have several new hires that I'd like to have introduced to the board, and so Mr. Kutz, if I could have you introduce Nancy Ramirez Partida. Nancy's not here.
Nancy's not here, but I would be happy to say a few words about her.
Please do.
Okay?
Thank you.
All right. Okay. Steve Kutz for the record, CCHS Division Director for another day. CCHS.
See how that one went right?
This is so loud. CCHS welcomes Nancy Ramirez Partida. She joined our WIC team as a community health aide on June 11th. She has previous experience working at Access to Healthcare, Planned Parenthood, and even as an intermittent hourly community health aide with our sexual health program previously. And she is currently assigned at our Moana WIC clinic, and we are thrilled to have her back with us.
That's right. Thank you, Mr. Kutz. And then we also have Ari, I have not said her last name before. I've just been calling her Ari. Ari Ayala? Somewhere close to that. Sorry about that. So Dr. Todd, could you please bring Ari forward and introduce her? And if we could have the record show that Mr. Young has joined us.
Did he bring refreshments?
Good afternoon. Randy Todd for the record. and it's my pleasure to introduce Arimar Ayala, and she goes by Ari for short, which might be a little bit easier to say than Arimar. Anyway, she is new to our EPHP division. She has taken Lei Chen's vacancy. Lei retired several months ago as the epidemiology program manager, and so we are pleased to have Ari taking her place. Ari comes to us from the Maricopa County Health Department in Phoenix, Arizona. So she's coming to a somewhat cooler climate than what they had down in Arizona. She was in Arizona in a couple of different positions with Maricopa County, that she's been working in epidemiology for quite a few years, and prior to Arizona, she had worked in Puerto Rico, and she obtained her bachelor's degree in biology from the University of Puerto Rico. She went on to get her MPH in epidemiology from Boston University, and she completed work on a PhD, except for the dissertation, in epidemiology at the University of California at Berkeley. So she is well educated and well qualified to take over from the work that Dr. Chen was doing, and we're pleased to have her with us.
Good. Right. Welcome, thank you.
And also on the agenda, we have a recognition of the 2019 Extra Mile Award for the Paul Mitchell, the school Reno. And I don't know that we have a representative here for the award, but if we could please have Ms. Dixon and Ms. Garcia Aguilar tell us a little about the award and why we're recognizing them.
Good afternoon. For the record, Erin Dixon, Washoe County Health District. You're absolutely correct. We've had a last-minute scheduling conflict, and unfortunately, Paul Mitchell, the school Reno, cannot be here. I do want to thank Claudia Garcia for all of her work on this project. But a little bit about the award. The Washoe County Health District's Chronic Disease Prevention Program likes to recognize local businesses for providing a smoke-free environment for customers and employees, and we'd like to thank you for this opportunity to do it here with you as well. The Extra Mile Award honors businesses that have gone above and beyond the requirements of the Nevada Clean Indoor Air Act, making the conscious decision to go smoke-free when the law does not require them to. This business was identified by our community for exemplifying a growing movement towards increasing smoke-free campuses. 85% of Washoe County residents do not smoke, and there is a growing demand for smoke-free environments. The awardee provides a smoke-free environment for visitors and employees each year. So we do have an award here for Paul Mitchell, the school Reno. Paul Mitchell, the school Reno, is a cosmetology school located a few minutes from downtown area. It opened as a smoke-free school in 2008. They wanted to create a smoke-free environment as part of their business so the students, staff, and visitors could enjoy their facility without exposure to secondhand smoke and without experience the smell and irritation of cigarette smoke. So we will make sure that this award gets to, it would have been Chuck Leosa, the school director, at another time. But thank you very much for allowing us to do this with your blessing. It's very exciting to be able to honor local businesses that do go above and beyond the Nevada Clean Indoor Air Act.
Thank you very much.
All right, so I think with
It's
that,
picture
we're
time.
exactly ready for pictures.
Bring all those down there, or Kevin gonna reach over and grab them?
I was just going to reach over the top
Okay.
and grab them. Hey, we just had our So let's
we don't have any.
Now that you're going to be sleeping in every day. You got one more day.
Dave would like his picture redone.
Because Steve said so.
I'm not good at that.
One more time. There you go, and one more. Oops. There we go. No, there we go.
You can see how much different she looks after.
Every 6 weeks, whether I need it or not.
Yeah, me too. Time.
Okay, 1, 2, 3, go. Cut off the top of the waffle. Go. Okay, very nice.
You got it? Okay.
Oops, we have one more? Oh, that's right. Oh, that's fine.
Welcome aboard.
Okay, 1, 2, 3, go. And one more. 1, 2, 3, go. There we are.
Arizona State right now, U of A.
Okay,
No agenda, no nothing.
yeah, great. Sounds good.
I hope.
Whatever works for you.
Yeah, I'll let you know.
Oh boy, plane was supposed to come in at 10:30. It's a little late. I had to pick them up.
Laura, thank goodness you're not retiring. Nobody'd take the pictures, so, good, thank you. Next item on the agenda is number 6. It's our consent agenda. Is there anything on the agenda we want to pull, discuss separately? If not, I'll take a motion for the agenda.
Move approval of the consent agenda?
Okay. Second. Mr. Brown, okay, all in favor?
Aye.
Aye. Opposed? Nay? All passed. Okay, moving way down the line here. Number 7, we have a presentation, Eliminating Single-Use Plastic at the 2019 Art Town. And just Beth. Where's, oh, there you are. I lost you.
Good afternoon. For the record, my name is Beth Macmillan. I'm the Executive Director of Art Town. I was able to pull together a committee that included Christina Conti, who had suggested that I come and speak before you all today. Also, Kate Thomas, the Assistant County Manager, Alexis Hill with the City of Reno, and the folks from Keep Truckee Meadows Beautiful. And I said, you know what, we do so many things at home to help our plastic use and sustainability at home. What are we doing about it as a community? And I thought, well, maybe Art Town can start making a dent in all of this. We sell a ton, because it's in the middle of the summer, obviously, we sell a ton of water. and we've been selling it in little plastic bottles. So how can we eliminate that? With 500 events, it's pretty difficult because I'm not in control of all 500 events. I'm in control of the Art Town produced events, and a lot of the events are put on, produced, and organized by other organizations like the Philharmonic or the museum or Sierra Arts Foundation, different organizations. But I thought we could take a stab at it as our Art Town. So we are working with Keep Truckee Meadows Beautiful and Blue Dot Water. The problem with Wingfield Park is not the same, which is a city property, not the same as the county property at Hawkins Amphitheater. There is no water source of potable water on the island because it's in a flood zone and there is no water source. So it's not like we can just bring in water. There's no water to access. So we are bringing it in 5-gallon containers. Keep Truckee Meadows Beautiful are having volunteers to man the stations to make sure that they're changing the water, to make sure that when people fill up their own containers of water, that that everything is kept very safe. And Men Wielding Fire is our vendor, and they're going to be there helping these folks. So if people have their own water container, they may hydrate and fill up with water all month long at the Art Town produced events. And in the little book, which I have left many of them where you get your agenda, in this little book on page 46, there is an ad saying that all the events with a blue little watermark, a little water droplet, indicates the events where water will be available for free all month long if you have your own water container, or we will sell these beautiful, these are not biodegradable, but they're very sustainable and they can be used for many years. They're silicone, they keep hot, hot, cold, cold, microwavable, dishwasher safe. That if you purchase this cup for the whole, you will get free water the whole month of July. They're great to take camping. They're very, very durable. And in addition, if you use this cup and you go and get a beer from our vendors, you will get $1 off your beer, so they will not be serving you beer out of a plastic cup. All the wine cups and all the containers that Men Wielding Fire will be serving the food out of or selling the food will all be compostable and biodegradable product. So we are really trying to take a stab at sustainability at Art Town. And I'm really hoping that in our little small way, we can start a movement or even change the culture of making a different thought process in your own world when you go and buy water. How can you make a difference? How can we not be using as much plastic and other products that we're using? So that's really what I came here to tell you. Do you have any questions for me?
You good?
I applaud the effort things. I think that's certainly a worldwide necessity that we move away from these things there too, and it goes well beyond just like single-serve water bottles and things there too. I was on a webinar this morning that I was participating in a project. We're trying to use rewashable beer bottles, which is a huge challenge, but it's the more we can get into reuse, the better off we are. So, good job.
Thank you very much.
Good.
And
Thank
hopefully
you.
we'll see you all at Art Town, starting next week, next Monday.
Wow.
Thank
It's
you.
here already. Thank you very much. Okay. Okay. Item number 8, recommendations for approval of a resolution to support the allocation of local revenues to Washoe County Affordable Housing Trust Fund. Take it away, Mr. Health Officer.
Thank you, Mr. Chair. This item is to support local funding, local revenue funding of the Affordable Housing Trust Fund. We heard in public comment from Mr. Klippenstein that the Washoe County Board of Commissioners has created the Affordable Housing Trust Fund, but there is no money yet that's been placed into the trust fund. And so in order for this to be an important tool in helping to advance and increase the stock of affordable housing that we have in the community, of course, there needs to be funds that are placed in that trust fund. The District Board of Health has identified housing as a top priority in the Community Health Improvement Plan. And in our Community Health Improvement Plan, we identify the project that Truckee Meadows Healthy Communities has been working on with their partner, the Truckee Meadows Regional Planning Agency, to work with enterprise community partners to create a regional strategy for housing affordability. And that report has been completed, and the Truckee Meadows Regional Planning Agency accepted that report at their meeting last month, the governing board for the agency. And it includes a number of policy tools that can be used, implemented in the region to help advance affordable housing. This is one of those tools that's identified in that strategy, and therefore I would recommend to the board to adopt this resolution so that the District Board of Health can demonstrate the concern that we have that we increase affordable housing in the region, and encourage our local governing bodies to help support that effort with funding.
Good. Yes, ma'am.
Thank you, Mr. Chair. And thank you also, Mr. Executive Director. I think the trust fund is important. Funding in the trust fund is extremely important. And so we are working, I met with the sheriff and met with Judge Hardy on a number of things to look at. We're looking at GST. We're looking at a number of other factors where there's a possibility of getting money into this fund. There's nothing more important than making sure that we have affordable housing, because currently we have living in our Record Street Center, and as we open up the NAMS campus, we will be moving families who have income. 70% of the people who are living in the homeless center actually have income of some kind, and the reason they're homeless is because there's just no affordable housing in this community. So there really isn't anything I think we can do that's more important than making sure we find housing. In the long run, it's going to save taxpayers money in Washoe County, because it's going to decrease the amount we're having to expend to take care of homeless and the various different issues that are going on. So I fully support this and hope that the board will support it.
Good, good. Any other comments? You take a motion to support this?
Make the motion to approve the recommendation.
First,
Second?
second. All in favor?
Aye.
Opposed? Thank you. Supported. Thank you for coming. Okay. Now, moving to the next page. If I can get there. Item number 9, public hearing. Ms. Albee.
Good afternoon, members of the board. For the record, Charlene Albee, Environmental Health Services Division Director. The item before you is a consideration for the adoption of a new fee, and at this time I'd like to turn it over to Nick Flores, who is the Senior Environmental Health Specialist that was instrumental in the project to get this put together.
Good.
Mr. Chair, members of the board, Nick Flores, Senior Environmental Health Specialist with Environmental Health Services. I'm here today to present the staff report for the proposed revision to the District Board of Health fee schedule to include a newly formed category of a mobile food unit prepackaged food permit. Just to provide you some brief background, the current Environmental Health Services fee schedule was adopted by the board in December 2015. Since that time, we've received multiple concerns from the regulated community that low-risk mobile food operators are adversely affected by the current fee schedule, which all mobile food units are required to get the same permit regardless of if they're low risk or if they're a full-service operation. So therefore, staff was directed to look into a potential new permit category with regard to units that only sell prepackaged items. So staff used our inspection data for these types of mobile units that might be affected. It turned out to be 35 to 40 permits And a fee was calculated that accurately reflected staff input into those types of operations. I believe a calculation sheet for the fee is included in your board materials. So since that time, staff has followed established procedures to move towards establishing a fee modification for these types of units to include public notifications and public workshops. During the May board meeting, this board accepted the business impact statement regarding this potential change. So the final step would be for the board today to approve the adopted revision to the fee schedule. Therefore, staff is recommending that the board adopt the proposed revision to the District Board of Health fee schedule for the newly formed category of mobile food unit prepackaged food permit. And I'd be happy to answer any questions or concerns that you might have.
Any questions, comments?
Yeah.
Yes, sir.
Nick, what is the other fee for the full at-risk food truck?
The current fee for all mobile units is, the annual fee is $500.
Okay, so this is a couple $100 less.
This is a
things to-
significant
Yeah.
decrease for these particular types of units.
Well, great, great. I think it's a great idea, and it's good to be kind of current and fair, and this mimics that, so.
Good. Any other questions, comments? Take a motion?
Mr. Chair, would
Yes.
you open the public hearing
Okay,
and inquire if there's any public here to comment?
thank you. Do we have any comments from the public at all? If not, we'll close public comments. We'll take a motion.
I move we accept this.
First, Mr. Young,
Second?
Ms. Burkett. Okay, second. All in favor?
Aye.
Opposed? Passed unanimously. And this does address Mr. Fanning's concern, so we have been working in that direction. Thank you very much.
One
Okay,
more time.
let's go for it.
For the
Thank you.
record, Charlene Albee, Environmental Health Services Division Director. I am going to turn this item over, which is an adoption of amendments to the regulations for the Washoe County District Board of Health governing food establishments, to Senior Registered Environmental Health Specialist Amber English, who served as the project manager on the development of this.
Good.
Good afternoon, Mr. Chair, members of the board. For the record, Amber English, Senior Environmental Health Specialist in the Environmental Services Division. So as Charlene mentioned, the agenda item you have before you today is for the adoption of the business impact statement regarding the proposed changes to the food establishment regulations. We held 2 public workshops on May 14th and 15th. We did not receive any negative comments or concerns about significant financial impacts to businesses. The proposed amendments would incorporate provisions from the most recent version of the FDA Food Code, which is a science-based, or a code that's based on the most current science and emerging technologies in food safety. So in addition to the very overwhelming 200-some pages of regulations, we also included a summary of changes document, as well as the PowerPoint presentation we gave at our workshops that highlighted some of the significant changes. So I'd be happy to take any questions. And actually before that, I would also like to just thank Dave McNinch for getting us to a point where we are putting these regulations forward on a regular basis and keeping up to date with the most current science and food safety. So thank you, Dave, for your support. Okay, good.
Thank you, Ms. English. Any questions, comments? We do have a packet with all the changes already here, so if nothing else, I entertain a motion to accept this.
Motion to accept as presented.
Okay, first, second. Second, good. All in favor?
Aye.
Opposed? Very good.
Thank you.
Thanks, Dave. Okay. Item number 11, discussion direction of staff according to the provisions of interlocal agreements. Ms. Amran.
Thank you. Good afternoon, Mr. Chair, members of the board. For the record, Leslie Admiran. The item we have here today is the annual review of the interlocal agreement. That is a requirement in Section 7C of the agreement. For the new board members, I thought I'd give like a brief history of the health district. In 1959, the legislature amended Chapter 439 to allow cities and counties to form health districts. After that, the county passed a resolution to create such a health district, but nothing was put in writing. There was an informal, unwritten agreement between the managers of the cities and the county to conduct this health district, but nothing in writing until 1972. After 1972, in 1986, the parties further amended the interlocal agreement, and that's what you have before you today. There was a further amendment in the 90s that just changed the composition of the board, but the terms remain the same. So I hope you've all had the opportunity to review the agreement. I certainly take any questions or take a look at any of the sections that you'd like to take a look at. Are there any questions?
Questions, comments? There's no changes, no revisions?
Not at this point in
Good.
time. So the action today is either to approve it in its current form or to direct staff to take any recommendations to the cities and the counties for further amendments.
Good, thank you. Any changes, comments, questions? Good, I will entertain a motion to accept it as is.
Move to accept.
Good?
Second.
Second, good. All in favor of accepting the agreement as is?
Aye.
Opposed? Another unanimous decision. Good work. Okay. And we are now down to number 12. Mr. Dowell.
Good afternoon, Mr. Chairman, members of the board. Dean Dow, President and CEO of Remsen and CareFlight, for the record. You've received copies of the May compliance report for your review, and I'm available to answer any questions you may have.
Good. Questions, comments? Take a motion?
Good report, very thorough.
Yeah.
Thank you. Staff works hard on it.
I'll make the motion to accept the report as
Good.
presented.
Okay.
Second.
Second, first and second, all in favor?
Aye.
Aye.
Opposed? Good. Carries unanimous.
Thanks.
Okay, now here comes the good report.
Thank you, Mr. Chairman. Alexia Jobson, Public Affairs Manager for REMSA, for the record. You have for your review the Public Relations Report for May. So today I will give you an update on a couple of our more recent activities. With the start of summer, there are warm temperatures, road trips, and time around water. All of this raises different safety concerns. So REMSA has put together a couple of videos with tips about water safety, car seat safety, and general summer celebration safety. These videos can be seen on remsahealth.com or on our YouTube channel. Earlier this month, Dr. Jenny Wilson, REMSA's medical director, was featured on KTVN's Ask the Doctor segment. She was sharing information about the importance of being able to quickly recognize the signs of a stroke. And finally, our most exciting recent news update is the reaccreditation of our Clinical Communication Center. For 18 years, REMSA's dispatchers, the region's first responders, have been committed to clinical excellence and providing professional emergency dispatching. All of our dispatchers are trained at a minimum as an EMT, and many of them have field experience, which, combined with the rigorous protocols and standards of the International Academy of Emergency Dispatchers, puts our Clinical Communications Center as a leader in the global EMD industry. This accreditation recognizes that REMSA has demonstrated to the citizens of Washoe County and to our first responder partners a serious commitment to providing patient care over the phone through an objective, protocol-driven process. Preparing for accreditation is no small task, but our supervisors, managers, and staff consistently rise to the occasion because they feel a tremendous sense of ownership and are proud of how they can contribute to the health and well-being of our community. Today, I would like to especially recognize and applaud Adam Hines.
sitting back there. Director for REMSA for his leadership of the Clinical Communications Center. I'm available to answer any questions you might have.
Good. Questions, comments?
Good, Adam.
Thank you. Okay. Next on the agenda is 13, update bill draft requests, bill drafts for the 2019 legislative session, which is over.
Hallelujah.
Yes, a resounding hallelujah. So.
Thank goodness.
Mr. Dick.
And, well, we're fortunate that now that the session is over, we have our government affairs liaison present, Ms. Joelle Gutman. And I wanted to thank Joelle for the tremendous job that she did for the Health District down at the session. She was there throughout the session. There were a lot of movement and progress on public health and on our the board's legislative priorities. I thought it was going to make it a little easier to have Ms. Gutman at the legislature, but I think that our engagement with the activity down there and opportunities for public health expanded exponentially because she was down there. So I'm not sure it took any load off of the rest of the health district, but I think the result was much greater impact in moving public health forward. So I will let Ms. Gutman provide her update to the board.
Good.
Good afternoon, board. It's nice to be back, especially because I live in this county. It was a long 120 days. There's lots of exciting things that happened. I'm sure some of you saw that on the news. But I think we ended the session pretty successfully and have an idea of what we want to, maybe even an idea of what we want to focus on next session. So I'm just going to highlight a few legislative priorities that you guys consented to prior to session starting, and then a couple legislative highlights just for the health district. So SB 425, sponsored by Senator Canizaro, was the 1915I Medicaid waiver that we have discussed. And this is a Medicaid waiver that will pay for certain additional home and community-based services. So it will provide tenancy support services for people that have issues with chronic homelessness and a hard time staying housed. So the funding mechanism, it's a match, and it's a complicated match that the Medicaid administrator couldn't fully explain to me, but it's up to a $2.6 million match depending on the service type provider and the population served in fiscal year 2020, and up to a $5.2 million match for fiscal year 2021. So in the community right now, we're kind of figuring out who is going to be able to provide those services. So that's SB 425. SB 448, which was sponsored by Senator Rowdy, provides for the issuance of transferable tax credits to a project for the acquisition, development, construction, improvement, expansion, reconstruction, or rehabilitation of low-income housing. So this goes with one of our health district priorities. And this is just one of the housing priorities or legislative bills that went through. Some of them didn't pass. A lot of them did, and they're all just small ways we can make improvement towards affordable housing and trying to solve our homelessness problem. So that was SB 448. SB 263 was probably our biggest win, and that was again sponsored by Senator Ratty. She was a real champion for us. This requires various alternative nicotine and vapor products and all of their components, including electronic cigarettes, vape pens, and other similar products to be taxed as other tobacco products, or the OTP product tax. So it requires wholesale and retail dealers of vapor products to obtain a license, and wholesale dealers to be required to pay a 30% tax. Vapor products are now included in our Indoor Clean Air Act, and they are prohibited wherever smoking is. It removes criminal penalties for selling to minors, but sets forth civil penalties for both the store clerk and the owner of the license. It requires a signature of a person over 18, and that packaging is clearly marked with the word cigarette or tobacco for internet sales. And there's a $2.5 million appropriation to DHHS, the Department of Health and Human Services, annually. And Washoe County Health District will receive about $200,000 of that annually for tobacco prevention efforts. So that was a pretty heavy lift. Kevin came down, Kelly Seals, and Nicole Alberti from Chronic Disease also really helped us with that legislative initiative. And then AB 66, which was brought forth by the Washoe County Regional Behavioral Health Policy Board, which Kevin is a member of. Excuse me. So this permits this permits the holder of a license who has a psychiatric hospital license to obtain an endorsement for a crisis stabilization center. So crisis stabilization centers are a step down from an ER, but a way that we can avoid inappropriately placing people in ERs or jails oftentimes. So this was a really big priority for Washoe County, and it also requires crisis stabilization centers to be Medicaid reimbursable. And then at the very end, they amended the bill also requires the State Board of Health to adopt regulations providing for the licensure and regulation of providers of non-emergency secure behavioral health transport. So that's an issue everywhere, particularly in our rural counties, but there'll be a separate licensure for behavioral health transport services, or there can be. So that was a good bill for our mental health priorities. And then a priority that died was AB 97, which was our public health funding bill. It got a hearing in Assembly Health and Human Services, but it sadly died on April 13th, the first House committee passage. So those were our legislative priorities, and then I just wanted to highlight a couple of other ones. SB 94 provides funding for family planning. So there's an increase in the governor's budget for family planning. $3 million a year, so that was a win for us. And AB 169 establishes a maternal mortality review committee, much like our infant mortality review committee. So this appropriates some funding and an appointed committee to really address, to look at the data and understand why. We have a very disproportionate rates of mortality among our communities of color. So this is a good win for public health. SB 37 was sponsored by the Committee on Commerce and Labor, and this expands the practice for marriage and family therapists and clinical professional counselors. It aligns them with the same abilities as licensed clinical social workers. And we were the only state in the nation that didn't have parallel capabilities. So we're really hopeful that this will increase access to care throughout the state. And then a couple of bills that we wanted to die that died was SB 4, we liked killed bills. SB 418 was a raw milk bill, and the Environmental Health Division really helped me. Tony helped a lot with this because I didn't really understand all of the risks of raw milk. But this would have really opened up the commercial sale of raw milk across county lines, and took away the milk commission that's established in NRS right now. So this made it through Senate, but we made sure that it wasn't heard on the other side. So this bill died a death on May 18th with the second House committee passage deadline. And then AB 231, Charlene, when she was with Air Quality Management, helped me a lot with this bill. And this bill, as introduced, required wireless testing to be used for emission tests, but they couldn't test cars older than 1996. So we would have had a lot of older vehicles on the road that weren't getting smog tested. And with Charlene's help, we gutted the bill, and it came to pass as just a bill that extends the amount of days that a new car has to be smog tested. So we were taken out of it completely. But those are my highlights. If anybody else has, one more highlight was AB 483. And this requires the Department of Motor Vehicles to conduct a pilot program to gather mileage data, so VMT data, which will help us with planning for air quality. So those are my highlights. You have this packet, you have this in your packet, and if you have any questions, I might be able to answer them.
If I could follow on that.
We're right ahead.
I think I'm on. Just to remind the board, so we had 5 legislative priorities that were identified for this legislative session. And we were successful in having 4 out of those 5 bills move forward, plus other beneficial legislation that moved forward. So I think it was an outstanding session for public health. As Ms. Gutman noted, we did not get the public health funding that we were seeking. However, we were not able to have that funding included in the governor's budget. So it was an uphill battle from the very beginning with an appropriation linked to that. So we're already having discussions, and we will be strategizing and acting beginning now to try to reach the governor on that issue and influence his administration to include that in the budget, so we're better positioned for next year. But I think everyone recognizes you don't always get everything you want right away through the legislature. And it was very beneficial, I think, to be able to discuss public health in front of the committee. At one time, that public health funding was also tied to SB 263. So we had great opportunities to talk about Nevada, 50th in the nation, and that expenditure, those expenditures, what that means for the state, what the benefit would be of more funding. We're very fortunate, I think, with the appropriation that the governor included in the legislation that passed for the family planning funds, and particularly with the reductions we've seen in our Title X funding. We are going to definitely be in line and trying to obtain some of that funding from the state. I wanted to recognize some of the partners that we had working with us during the legislative session. On SB 263, the e-cig and vape bill, Michael Hackett with the Nevada Tobacco Prevention Coalition, and also representing the Nevada Public Health Association, was the lead lobbyist working with Senator Ratty on that bill, and he did an excellent job. With that, we had the Southern Nevada Health District's lobbyists engaged also. They use Argentum, was involved with that effort, and the Nevada Medical Association as well. So great partners with that effort. We also, I wanted to recognize Chuck Duarte, who was the chair for our Regional Behavioral Health Policy Board. He did an incredible amount of work on AB 66, the Crisis Stabilization Centers, and was successful in figuring out how to develop that language so that it created the market conditions to allow those centers to succeed. And then also Heidi Parker for her work on SB 94, the family planning bill. She was a champion working on that one. So just some great partners that we had working down there. And Joelle was very effective in networking and finding allies to work with on a number of the bills. So just wanted to recognize them.
Yes, ma'am.
Oops. I just wanted to say thank you very much for an excellent job, having spent many years working the legislature, a number of which were in the medical field. I know these are all tough issues because we have, whether we like to admit it or not, we really are a citizen legislature, and you don't have a lot of legislators down there who really grasp the key information that's coming out in a lot of these medical bills. So great job. The fact that we only lost one bill is, that's fabulous. Amazing. And so I thank you very much for all the work you put in and for all the good information we have. So appreciate it.
Thank you. I was happy to be there, and I'm already really looking forward to next session because I will be able to speak better to public health and the issues that are important to Washoe County Health District.
Boy, I'm glad I don't have to go there anymore.
It's only like 600 days. Thank you.
Ms. Gutman, thank you very much for a new hire. That's quite a job we just dropped you in the middle of. So
Yeah.
we're glad to see you back.
Good
Glad you
job.
survived. And liking the idea of coming back again. So good. Thanks for.
Thank you.
Go ahead. Mm-hmm. Yep. Okay. Flipping over here.
Do we need to take action on it?
Do we need action on that?
It is an action item, but it's for possible action, so if there's no action to be taken, we don't
Okay.
need to.
No, I think we'll just accept it as a report. And let's see. I don't have anything in my, where is that?
Staff reports.
Oh, under staff reports. Good. Okay, I've got that. Okay, we have staff reports now, air quality management. Mr. Inouye.
Good afternoon, Mr. Chair and members of the board. For the record, Daniel Inouye, Acting Director for Air Quality Management Division. In addition to the director's report, I have a couple items that I'd like to update you on. First is earlier this year, you provided direction to us to review our open burning regulation. We have been meeting with local fire agencies from Reno, Sparks, Truckee Meadows Fire, and Incline Village through through North Lake Tahoe Fire Protection District. We've been working with them to update the rule through revisions. Their input has been very instrumental on implementation to make sure that what we are revising is doable at the boots on the ground level. We have a draft revision ready to go for public workshop. Some of the highlights of that is that we will be looking at the open burn season based on weather conditions, not necessarily the calendar. And also, we will still retain and revise the requirements to protect air quality here in the Truckee Meadows Basin, where we have a history of, or had a history of, problems with particulate matter and carbon monoxide. The bottom line is we're going to take advantage of the good weather conditions that we see in the wintertime, where it's good for burning and it's good for air quality. So we think we'll have a good product to bring to you later on this year. We have public workshops scheduled tomorrow at the Health District, July 9th at Truckee Meadows Fire Station 33 on Foothill Road. And on July 11th, we'll be holding a public workshop at Station 40 in Mogul. Our tentative timeline is to come back to the board in August with the business impact statement, followed up with the public hearing in September, Board of Health. I have one more item, but if you have any questions on the open burning regulation, I can bring that or address those at this time.
Questions? No? Go right ahead.
Okay. And the other item is I'd like to congratulate Steve Cutts on his retirement. He's been a great champion for air quality management, especially through his chronic disease prevention program. Steve's been able to connect the dots between air quality and chronic diseases such as obesity rates and diabetes rates. His team has been very great to work with. We're able to get more things done with the power of the collaboration. One of the common denominators between our groups is advocating for strong active transportation networks, and that's the backbone for more walkers and pedestrians. And when we have that, not only does it improve public health, but it also takes cars off the road and improve air quality. So when air quality management advocates for things like shaded and connected multi-use paths, not only does it support air quality, it also supports the chronic disease prevention program and also a healthy community. And congratulations, Steve. and available for any other questions.
Questions, comments?
Good report.
Good, good. Thank you, sir.
Thank you.
It's the last report.
It's his really is his last report?
It's my last report, yes, Steve Cutts, for the record. So I just wanted to highlight something in our report, our client satisfaction survey results from 2019. We've been doing this for many, many years now. We've been fortunate enough to get overall very good results, but I really just wanted to say how proud I am of the CCHS staff and the great service and experience that they provide to our clients and our internal and external customers. And I couldn't be happier to have been part of CCHS for the last 30 years. It's been awesome. I also would like to comment that it has been great working with and for Mr. Kevin Dick. He's been an amazing boss. I appreciate that. I've enjoyed working with the various divisions. Air quality is always great. Dan's been a great champion, as has Charlene. I'm super excited about her new role as the Environmental Health Services Division Director. She's going to be awesome at that. Have had great support in Administrative Health Services with Anna Heenan, Nancy Kearns-Cummins, who is not here this week, unfortunately. Loved working with epidemiology, public health preparedness. Dr. Todd and his staff has been great. It's been a pleasure reporting to the board, and I will miss everybody here and what I've done. I've loved public health, and thank you so much for the opportunity to serve Washoe County. Oh, and with that, I'd be happy to answer any questions you may have.
Thank you.
You're going to miss us come Monday morning.
A little bit. Thank you.
At least it's a little bit. Ms. Albee, with her new hat for director.
Good afternoon again. For the record, Charlene Albee, Environmental Health Services Division Director. I wanted to say thank you for the opportunity to grow my professional career as the leader in EHS. I will say that it's been a hit the ground running. There's a lot of things going on in a lot of different directions, and staff has been tremendous in stepping up and grabbing me by the elbow and getting along. So I think that we have a wonderful group, and that we've got lots of good stuff to be coming along in the future. Wanted to also wish my best to Steve Cutts. We've worked together for 24 years now, so it's been a long time. And then just wanted to express my personal gratitude to Dave McNinch. He and I both have worked together for 24 years also, so it definitely is the beginning of the silver tsunami, but I think we have to look at it as now we have all the new young blood coming in that's going to really re-energize us, and I think there's some real resources there that we're going to be able to take advantage of. So I didn't have anything else, and I'm available if you have any questions.
Good, thank you. Any questions? Good. Thank you very much. Okay. Next, we have Dr. Todd.
Good afternoon again, Mr. Chairman and members of the board. Again, Randy Todd for the record. I just wanted to highlight one thing in my prepared report, which you should have in front of you. Measles continues to be on the forefront of concerns. Nationally, we have now gone, as of June 20th, we've gone up to 1,077 cases in the nation. That is, those cases are confirmed in 28 different states, and that's the greatest number reported in the U.S. since 1992. Measles, I think I've mentioned before, was declared eliminated in the year 2000, so we've gone backwards a significant amount. Fortunately, in 2019, we've had no confirmed cases of measles in Washoe County. We have had, I think we're now up to 17 cases. I put in my report 16, but I think we just had another one here the other day that was ruled out but 17 people have been suspected of having measles, and it's been ruled out, so that's good. And that was all I had on my prepared report. I would be happy to entertain any questions that the board may have.
I've just got one kind of question. Some of these suspected cases of measles, is this in the younger age group of physicians and stuff that may have never seen this before?
Yes. Yeah, quite a few of our practicing physicians now are young enough that they had never seen an actual case of measles in their medical practice. And so it's somewhat difficult for them. They see pretty much any rash, and you know, if there's a concern about measles, they'll want to try to rule it out with some laboratory testing, which is okay, but it's a little bit surprising from the perspective of somebody who grew up in the measles era and had measles. I think I had both kinds of measles when I was growing up. But anyway, that's kind of what's going on. The other thing is, I'd just like to add my congratulations to Steve for managing to get 30 years in here. He's been a great partner. I knew Steve back when he was working here, but he was also a student at UNR, and he took my epidemiology class back then. Second class was my first graduate course.
Good.
And he was a great student. So anyway, that's all I had.
Terrific. Any questions? Good. Thank you very much. Okay, coming near the end. Mr. Health Officer.
Thank you, Mr. Chair. Wanted to provide the board with an update on our public health accreditation efforts. We just had our site visit, which occurred just over the last couple of days, Tuesday and Wednesday of this week. So we had a site visit team that included 3 representatives from other local health departments and 1 representative from the Public Health Accreditation Board's organization. And we met with them. We had numerous staff involved that have been involved throughout as members of our accreditation team, but also additional supporting staff to be able to talk about our work in the various areas of the domains. We had an exit briefing that was conducted with the site visit team. They informed us that they will be putting together a report. They don't actually make a recommendation as to whether we receive our accreditation or not, but they take their report back to the Public Health Accreditation Board, and their next meeting will be on August 20th. We could be determined to receive the accreditation, or the other course is that we might be tasked with putting together and implementing an action plan if they have other areas that they feel like we need further work on. They did identify to us, as they do in all of their site visits, 3 strengths and 3 areas for opportunities for further development for the health district. And the first strength they identified was board engagement, and so I think that's fantastic. And I wanted to thank our chair and vice chair and Councilman Delgado that came over and met with the team yesterday morning. And I also had a chance to talk with them about how we work together with the board. And one of the things that I kind of really liked during my discussion with them was they were feeling like they were hearing the same thing from the board team and myself, that we feel like we're operating together as a team. And so they very much, that resonated with them, and they felt like we're really in a good place with the board. So I appreciate the support of the board and how we're able to work together like that. The other priority area or strength that they identified was community engagement, and we had a session with close to 20 community partners that came over and met with them, and they were really impressed with the the level of engagement and partnership we have with different organizations in the community and how they view the health district and want to work with us. The third area was in communications. They felt like we were strong in how we were communicating public health information to the public. The areas for or opportunities for development, I think we were, all of us in the exit briefing were a little surprised when they said that they felt like we needed to develop more policies because we feel like we have very, very, very many policies that we operate under. So it'll be interesting to see what they put in their report and whether they were able to really understand how it is that we work with the county programs as far as policies that we fall under as well. Another area was health equity, and I believe this is a challenge for health districts across the country, and I don't disagree with that, and I think we'll continue to work toward better health equity and approaches to implement that in our program. And then also they identified performance management. And I think while we've developed a strong performance management system for our strategic plan, we don't have a strong system in place for our ongoing programs, operational aspects of the health district. You receive a monthly report from each of the divisions. You receive information about the services that they provide, how that compares to the other months, how it compares year over year, but we don't really have that all captured in one system. I'm glad to report that we are going to be moving forward with using a performance management software platform. Ms. Peters has researched a number of different systems that are available, and we've decided to move forward with ClearPoint, which will be a platform that we can use for managing our strategic plan, putting together our performance management system for our programs, potentially also use for performance management for our community health improvement plan. So we'll be working on that over the next few months, and we think it's got a really nice also dashboard features to it. So I think we're well on our way in that area to really taking a leap forward. So that's where we're at now. It was an incredible amount of work to do all the things we needed to do to become accredited. And I think the real benefit to the health district is the work that we did and the systems that we put in place. We wouldn't have embarked on a community health needs assessment and a community health improvement plan and whatnot if we didn't have those as criteria of things that we needed to address. It really kind of helped frame up for the health district how to move forward to become more effective for our community. So we'll see how we do with the site visit, but I'm pleased with where we're at and the work that we've done to move the health district forward. And then on Truckee Meadows Healthy Communities, I mentioned earlier that the Regional Governing Board for the Truckee Meadows Regional Planning Agency accepted that regional strategy for housing affordability. Truckee Meadows Healthy Communities fundraised over $250,000 from community partners to support developing that study. And so I just wanted to recognize the broad support that we have in the community to address this issue, and we had a number of non-governmental entities that invested in that project. The efforts of Truckee Meadows Healthy Communities were really focused on getting this strategy put together, but recognizing that Truckee Meadows Healthy Communities wasn't really the best group to implement the strategy. And so I'm pleased to report that earlier this week, the Reno Housing Authority Board met, and they have agreed that they want to move forward and push the implementation of the plan. So I think that's a really significant additional move that we've got, and Truckee Meadows Healthy Communities will continue to advocate for affordable housing, but we really wanted to have somebody that was well positioned to help implement this plan. And I believe that's the items that I wanted to highlight. I want to also express how grateful I am to have had Mr. Cutts on staff at the Health District and have the opportunity to work with him. He just brings a positive attitude every day to his work at the Health District, and I think everybody at the Health District will miss him. So thank you, Steve.
Good. Questions, comments? Good. Now we come down to board comments, items limited to things for the agenda and stuff, so. Nothing? 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 Whoa, good. I do have a couple small comments like that. I have met with several of the different fire agencies in the last couple of weeks. They have requested if there's something on our agenda that may need their input, if we can put this a little bit farther up on our agenda program that may involve them and their needs for comments, so they, can get on with their duties as first responder. I think that's very good policy and keep them out there, not just sitting here. So if we can consider that, I want to really thank the whole health department staff, and especially Katrina and Felisa for putting together an amazing amount of work for our FAB accreditation. And those people here, and we've had a whole FAB team that have all had a lot of input. It is a phenomenal amount of work. If we can get through it, which we are, we're going to make it. We will be certified one way or the other real soon. And that's a real feather in our hat, because as they brought up, we have a very all-encompassing health department. We don't have just a couple little things here and there. A lot of health departments do not have air quality management and stuff with them. So we have covered a lot of ground. We're very proud of it. That came out in when the board members met with them. We really think we got a heck of a health department. And what we do with the amount of money that we don't have, that we do, I think we have done a phenomenal job. And I really want to thank each and everybody in the health department for all the hard work in getting this done. It's taken us almost 2 years to do that. So, and the last thing, Mr. Cutts, sounds like everybody's going to miss you around here. So Monday you can bring coffee and donuts and just visit with us. Any other comments or anything? If not, let's adjourn. Public comment. Oh, I'm sorry, public comment. Nobody's left? Okay, now we'll adjourn. Thank you very much.